Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
It could be the end of public media as we know it. Congress is considering pulling back critical funding that supports stations like Boise State Public Radio. If you care about independent journalism, visit boisestatepublicradio.org/funding and take action today.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Last week, Secretary of Health and Human Services Robert F. Kennedy Jr. removed all members of the CDC's Vaccine Advisory Committee, a decision that's drawing strong reactions from both supporters and critics. Now, some see it as a push for reform, while others worry about the impact on public health guidance. Well, joining us now to talk more about this is Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, make sure you send us an email at idahomatters@boisestate.edu. So, Dr. Pate, let's just begin with the basics. What is the CDC's Vaccine Advisory Committee?
Right. So this is a committee that was put into effect, I believe, in 1964. So it has already spanned 11 administrations, and it has been a highly effective group of appointees that are screened and vetted, appointed by the CDC director to serve 4-year terms. And what this group does is after the FDA approves or authorizes a vaccine, then this group looks at the data to determine who specifically should get that vaccine, when should they get it, and the guidance for physicians as to how to actually who should get that vaccine, when they should get it, and under what circumstances.
And Dr. Pate, when Robert F. Kennedy Jr. did this, he said, and I'm quoting from a statement, he said, quote, a clean sweep is necessary to reestablish public confidence in vaccine science, unquote. And he also said there were conflicts of interest among these members. What do we know in regards to this idea that we need to reestablish public confidence in vaccine science?
Well, several points here. The first thing is, it is ironic that Secretary Kennedy believes that the ACIP is undermining vaccine confidence, when that has been most of Secretary Kennedy's career, running an organization that undermines vaccine confidence. So quite ironic. As to his specific criticisms, one was that these meetings are held in secret, behind closed doors. That is not correct. These meetings, I've never been physically at one of the meetings, but I listened to it. I can look at the materials for myself. So it is held publicly, and so that is not correct. Another point is what you just mentioned, that he's pointing to conflicts of interest. Well, look, in my career, I've had to deal with conflicts of interest among employees, leaders, board members. Conflicts of interest or potential conflicts are very common. It's something I used to have to deal with every day. But there's ways to deal with it. And the issue on a advisory committee like this one is, if you get the top scientists and leaders in the field of vaccinology, many of these will be doing research on vaccines and therefore will have potential conflicts of interest. So that is not surprising. The question is, are you managing them? And the answer is yes. For about a quarter of a century now, members of the ACIP have to submit forms that disclose their conflicts or potential conflicts. Those go on the website, those are vetted, and they are reviewed at every meeting. Anytime there's going to be a agenda item that might raise that issue of conflict, those are disclosed at the beginning of the meeting, and then you manage that. For example, that
Hmm.
those persons that would have a direct conflict, they would not vote, that kind of thing. So it's something that's going to always happen. The other point is Secretary Kennedy has not seemed to have a problem that some of the people he's newly appointing have conflicts of interest. So I'm not sure what problem he's addressing, because the things that he's said publicly are either not true or are not resolved by the new people that he's appointing.
So, with that said, Secretary Kennedy did say to ABC News when he made this decision that he would not put, quote, anti vaxxers on this new committee. The other thing that he said during an interview with ABC News is that the current list of vaccines that are recommended for children will be reanalyzed by these new members because, quote, he doesn't trust the science that led to their initial approvals, unquote. I mean, we should note Robert F. Kennedy Jr. is not a medical professional in any sense of the word. Um, but what do we know so far about the 8 people that he has appointed at this point?
Well, first of all, as far as not appointing any anti vaxxers or vaccine skeptics, whatever you want to, the phrase you want to use, several of them clearly are. Some were already known to me in my work in trying to understand what this movement is and what their arguments are so that I can inform people as to whether what they're saying is true or not. So he's got a huge anti-vaxxer on the committee already in his appointments, and several others that have been skeptics. Again, others with conflicts of interest, and so that's an issue. This whole business about doesn't trust the science. Well, we need to keep in mind that the papers that have the CDC has submitted, identifying, for example, that pregnant women are high risk, and that science is settled that they are high risk for COVID. They are more likely to have severe disease with COVID and is more likely to cause problems in the unborn children. I think that is firmly proven now. He, after even acknowledging that, then in his latest guidance, where he just overrode the ACIP itself, he said they're not eligible for they're not under the recommendations for COVID vaccines. That is
Hmm.
not consistent with the science. And in fact, I think that for me, anytime that he or his lieutenants mention that they're just trying to follow the gold standard science, that is what should set off sirens and lights in your head, because they're trying to have the public believe that what they are doing is gold standard science, whereas what we've been doing all these decades is not, and they're wrong about that. And we talked a couple of weeks ago about a paper that they used to judge or to
Hmm.
support their recommendations about the new COVID vaccines. And it looks like that was probably largely generated by AI. It had citations to studies that didn't exist. It had other references to studies saying that it showed something when in fact that study showed something completely different. So if there's a trust issue, I think it is on the part of Secretary Kennedy and his lieutenants, and they need to start being transparent and show us the data that they think is overturning these decisions.
And just on Monday, Dr. Pate, the former advisory group, speaking as a collective whole, actually published an editorial in the Journal of the American Medical Association. I'd kind of like to talk a little bit about what they said. It was quite long. Anyone can go look at it at the Journal of the American Medical Association. But the first line, Dr. Pate, is vaccines are one of the greatest global public health achievements. Can we just talk a little bit about that? Because they also go on to say, they talk about the COVID vaccine and how scientific advancements enabled the accelerated development and production and evaluation of COVID-19 vaccines. And you've stated even on this show over the last 5 years, Dr. Pate, is that we would have been in a much worse situation if it hadn't been for Operation Warp Speed.
Oh, absolutely. Vaccines in general have to rank. I mean, I'm not sure if it is it one, two, whatever. They have to rank among the most important scientific, public health, medical advancements that have ever been made. They are responsible for saving countless lives, and particularly even in instances where the disease would not have killed the person, there are so many success stories of vaccines where they have prevented long term complications. Now, many listeners are not old enough or aware, probably, of the polio hospitals we used to have, where we had that were the springboard to rehab hospitals, where we had the iron lungs with patients in them. They may not, people may not have ever seen an iron lung. I have. I've seen what this is like and what it used to be, and it was a tremendous fear. I spoke to my own mother to find out, tell me about what the sentiment was. Parents were petrified about what might happen to their children. Polio vaccines were a huge advance. We've eliminated smallpox from the globe. Except
Mhm.
in military reserves and so forth. Now smallpox is not a deal. We eliminated measles from the United States and many other countries. There are so many successes, and to think that at this point we are losing so much ground is really disheartening. To think that we're going to have to learn all these lessons of the first half of the 1900s over again because the vaccines have been so successful that most people don't realize the dangers of these childhood illnesses, and we're just going to let them rip again. And that is hugely demoralizing, but appears to be the road we're headed down.
That's such a good point that you make, though, Dr. Pate, is that the vaccines have been so incredibly effective that many people truly don't understand the true efficacy of the vaccine, but also the true harm of many of these diseases that we have eradicated or that we have at least been able to get under control with vaccines. So, what are your concerns about a move like this in regards to like trickle down effect, right? Are we going to see more people who you have the right to question vaccines 100%, but who may say they're not necessary, or are we going to see, frankly, more people potentially get sick from things that if we were vaccinated from, maybe you wouldn't be going down that path?
Well, I think it's the latter, Gemma. I think that I have feared this is where we're going because this was an issue the entire time that Secretary Kennedy was going through his
His
process to
hearings.
be appointed,
Hmm.
right? Confirmation process. And many of us, understanding his lifetime work, were rightly feared. And I thought that ACIP would be one of his targets. He assured everyone it would not. And of course, now he's making it happen. He also assured everybody that he was not going to take away anybody's vaccines. Well, I and maybe that will be literally correct, but what I fear is that this new group of appointees is a group that is really going to start dismantling all of the previous vaccine recommendations. And so it doesn't literally get rid of the vaccines, but what happens is that that it will mean that the vaccines may not be covered by insurance, and therefore a lot of people won't have access because they can't afford it. Plus, the vaccine schedule that is approved by ACIP is the one that is used to drive the Vaccines for Children program. And I don't think people understand in this country, but from 2012 to 2022, 52% of children in the United States qualified for the Vaccines for Children program because they were uninsured, underinsured, Medicaid eligible, or otherwise at risk. And that's 52% of our children that's probably the only way they could get these vaccines. So this is very scary. And I do fear that instead of making America healthy again, we're going to make America go through all the childhood vaccine preventable diseases again. And this is terrifying to somebody who understands what those diseases do to a large population.
So, Dr. Pate, on Monday, a federal judge ruled that President Trump's directive to cancel NIH grants or void and illegal. So, Dr. Pate, can you start out by telling us about these grants and the research that was happening?
Reasons that the United States has taken a leadership role among the world countries in our scientific advancements, and particularly our medical advancements, and why people from all over the world come to the United States for their care, is that we have had a wonderful private public partnership in that the federal government has allocated funds to through the NIH that are subject to researchers submitting grants, and then they're very carefully reviewed to determine which are the studies that are most worthy for the funding. And then this funding is given to allow the research to take place. A lot of times, research that wouldn't have immediate financial returns that a pharmaceutical company would undertake or other would fund. And so it's been a critical piece, and they're very hard to get, very difficult to get NIH funding. And so what happened, as you mentioned, is some of the grant recipients and some of the states who benefit from this, which, by the way, that NIH funding to those institutions and researchers within those states ends up being having a lot of positive ripple effects for those states because it has helped them attract these scientists, higher income earners, more tax revenue, people coming to those states for school, for care. So it's been financially beneficial to states too. And when this funding was cut off immediately, they filed these cases in court.
So, with that said, Dr. Pate, what did this federal judge say in terms of why these executive orders were illegal and that the funding has to be given back? And as you said, we're talking close to like $2 billion in funding.
Yes, and the lawsuit that you're mentioning, to my recollection, only accounted for about a third of all the grants that were
Hmm.
cut off. So there may be more litigation on this. But with respect to this, the judge said that the decision was arbitrary and capricious, which are legal phrases and words that tend to mean that there's just doesn't seem to be a rhyme or reason and not a good logical reason for discontinuing that support. But in his comments, as he was announcing his decision, what he indicated was that this decision was just loaded with discriminatory action. In fact, in all of his years on the bench, he had not seen anything so facially discriminatory, which obviously influenced his decision.
And Dr. Pate, I want to talk now a little bit about COVID because more than 5 years after the first case of COVID-19 was detected in the United States, data released from the Centers for Disease Control and Prevention, and they released this just a couple of weeks ago, shows that on average, about 350 people a week are still dying from COVID in the United States. Um, I frankly was a bit surprised by that number. I don't know if you were, but what should we be taking away from this?
Right. I was not surprised. And frankly, I believe those numbers are going to be relatively low numbers compared to what you and I will likely discuss over the next year. And I'll
Mm.
explain why. But no, I've been following this, and I think so many people just don't want to talk about COVID, don't want to hear about it, and so we tend not to give those numbers a lot of attention. I'm glad you're bringing those up, and we have to realize that this is still a threat. COVID has not gone away, and what I think why say I think they're on the low side is that if you look at the variants that we have been dealing with for the past year, they really have not had a we've not had a game changer come around like we did with
Mhm.
Omicron in 2022 or Delta in 2021. And it is possible that we're going to have something like that come again. I don't know if it will, but what I think is the reason why I most suspect that we're going to see cases go up is that because people have been lulled into thinking that COVID is not a significant threat, we see very low rates of vaccination. Less than a quarter of people that COVID vaccines are currently recommended for are getting them. And if you look at kids, that number is down to less than 15%. And so I
Wow.
do think that we are going to see a lot more waning immunity, people that have not been taking this seriously, that have not been vaccinated in quite some time, who are going to get re exposed to COVID and maybe one with more potential problems. And I do think that probably even later this year, we'll see that number go up considerably. We have to remember that still the oldest among us are at the greatest risk, but also the youngest. And this is what terrifies me about the decision that and the announcements that Secretary Kennedy is making about the COVID vaccine not being recommended for pregnant
Mhm.
women. We are going to see more maternal deaths. Mark my words
Mm.
on that. And as a consequence, we will see more infants with problems as well. And people don't know that long COVID is really wreaking havoc, and including among children, in which it has now become the number one disability among children. So it has not gone. I think we're going to see worse come, and we just can't put our heads in the sand.
Mm. And Dr. Pay, I only have about 2 minutes left with you, but the other thing I wanted to talk about very quickly in regards to COVID is the CDC says a lot of people are not accessing COVID treatment anymore in the form of antiviral pills like Paxlovid. Now, I'm curious, is that because, I mean, so many people don't even test for COVID anymore, right? So you have to start this within 5 days of your symptoms appearing. But if you're not even testing at home anymore, well, of course, you're not going to be getting the treatment because you might also just think you have a cold or something like that.
Well, exactly right. And in addition, now Paxlovid is not being covered by the government, and that's a
Mhm.
very expensive medication. So there are a lot of people who are getting COVID who would be good candidates for an antiviral, but they either don't know they have COVID, or they don't know that there isn't an antiviral out there for them, or they don't know how they could afford it. Fortunately, there is an alternative with metformin that has been shown to perhaps even have a greater effect at preventing long COVID. But your point is correct. We should not take this for granted. Continue to test. If you do have COVID, get in touch with your doctor right away to see if you are a candidate or should be on some kind of treatment.
All right. Well, as always, Dr. Pate, we so appreciate all of this information. And as you said, I do not think this conversation about uh, vaccines and about where we are with COVID will be ending anytime soon. With that said, we've been speaking with Dr. David Pate, former CEO of St. Luke's Health System. He's also the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question for Dr. Pate, make sure to send us an email at idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Planet Money helps you understand the economy. We find the people at the center of the story.
Garbage in New York, that was like a controlled substance.
We show you how money influences everything.
Tell me what you like by telling me how you spend your money.
And we dig until we get answers.
I had a bad feeling you're going to bring that up.
Planet Money finds out. All you have to do is listen. The Planet Money Podcast from NPR.